Hi, my name is Chandreyee Banerjee and I work with Catholic Relief Services. I just wanted to ask you, have you been involved in an emergency response? Today I'm going to share with you a few stories of emergency response and preparedness that I have been involved with working with Catholic Relief Services. Let us discuss now a few common classifications of emergencies. Generally, you will hear people talk about natural disasters, human-made disasters. You will also hear people refer to rapid onset disasters and slow onset disasters. So when you're talking about natural disasters, very simple, caused by natural elements. For example, your hurricanes, your floods, your droughts, those would be your natural disasters, would come under that classification. When you're talking about human-made disasters, think about Syria today. The disaster is the effect of human beings, of what people did and do. When you're thinking about the nuclear explosion in Japan, human-made disaster. When you're thinking about other cases of Sudan, etc., human-made disasters, Iraq, human-made disaster. Then we talk about rapid onset disasters and slow onset disasters. Rapid onset disaster, when you think about Katrina, that was a hurricane that came rapidly. There was no slow movement of this particular emergency. So cyclones, generally floods, these would fall under the category of rapid onset. Then you have emergencies like drought. These don't develop overnight. You have a certain period of progression of this emergency. So these would be your slow onset emergencies. Now, emergencies like Haiti and Syria can also be categorized as complex emergencies. So when you're discussing emergencies, often you will hear these terms mentioned, and this is the background of these terms that will be discussed and mentioned to you. Close your eyes. I want you to think about December 26th, 2004. What does the date mean to you? That date and what happened that day changed the lives of millions of people across the world. And it changed the way emergency response was perceived and done. That was the horrific day when the tsunami hit South and Southeast Asia and actually went up to the coast of Africa. The magnitude of the tsunami, you will remember right after Christmas. The day of Christmas, you're probably celebrating the day with your families. I remember this TV program come up and scene after scene, news after news, what we heard was unbelievable. It was horrific. I remember on December 26th, I was traveling to the airport to go and meet a friend in New Orleans. We were going to spend New Year's together with her grandmother. And I receive a phone call and I'm asked to turn back from the airport and come back to the office. And then started, all of these pictures and images of how people, millions of people, we found out at the end of that week that it was about 200,000 that were affected and dead. Over millions of people who had lost families and lost houses and lost their livelihoods. It is by far one of the most horrific emergencies that I have been involved in. CRS had partners and staff in all of the countries that had been affected by the tsunami, especially the 3 countries that had been affected the most. Those 3 countries were Indonesia, India, and Sri Lanka. And our partners, along with our staff, they had a lot of experience in emergency response, And they immediately went into gear despite their own trauma. Their families had also suffered through the tsunami, but they immediately geared up to do a quick assessment of the situation, to do quick search and save lives, and then look at what the response needed to be. But despite having team members and our partners in all of these countries, you will remember the magnitude of this huge emergency. And this was a huge task. You were looking at large numbers of people affected, huge trauma for the world. Everybody for days to come couldn't move from in front of the TV. You were looking at people who had been affected, or looking and trying to find whether your loved ones who had traveled to Thailand, Southeast Asia for the holidays, whether they were okay. We remember, because of the magnitude of this emergency, the way we responded, the way we organized the response was very different than any other emergency that I had been involved in. We had to immediately find team members, national staff, partner staff, international staff with experience in emergency response across the world. And thank God, CRS has operations in over 100 countries. We were able to pull from our different country programs, from our partner staff from all over the world, and organize for them to go to India, to go to Sri Lanka, to go to Indonesia, to work with our staff and partners. The areas of lives that had been affected through the tsunami, it had not left anything untouched. Shelters were gone. Lives and health of people was affected. Livelihoods were gone. Protection of children, women, people became a huge issue. Trauma, oh my gosh, what a traumatic event. So you were looking for specialists also in all of these areas to guide a very high quality, effective response for the people. We were able to find from within our organization and our partner organization, again, very, very high quality technical people, and send them out, again, deployed them to work with our teams who were already on the ground or who were being sent to work in these countries. So this was an experience for us in terms of major deployment, major identification, sourcing, and deployment of our team members. Trauma was a huge issue. With every emergency, the communities that are affected go through trauma, but your staff, who are also supporting those communities, and your partner staff go through a lot of trauma. I remember this incident. I am in the office late in the night because that part of the world was 12 hours behind our time. I was in Baltimore, working in our headquarters office at that time. And I would receive calls from all our staff members who had worked with me before. They knew me well. And I remember this particular call that had come in where this team member, she said, I can't take this anymore. I'm traveling and all I can see, she had just been deployed to Sri Lanka. I'm traveling and all I can see are these little hands sticking out of the ground. And I have a little child, and all these hands look like they're children's hands. So imagine the level of trauma that your own team goes through. Along with this need for an emergency response of a scale and kind that had not been seen before, we also had a completely different engagement of the media. For the first time in the history of emergencies, you got every second of media coverage. Media was out there covering what had happened, what was happening, what response was needed, what response was being provided. And I remember many of our staff members who had microphones stuck in their faces because they were being interviewed by the media. They didn't know what to do. This is not what we are trained for. We are trained to respond. We are trained to help recovery efforts. We are trained for development. And so this was a learning experience for us. But what the media also did, because it immediately connected people from all over the world to people here in the areas, there was an outflow of generosity. I remember our teams being on the phone forever, taking calls from people who wanted to provide resources, fund this emergency, who wanted to go out themselves and support the emergency. I remember another incident. I was on the phone talking to somebody in the Senate in Washington, and our receptionist from downstairs calls me up and she says, "You have to come down right now." I said, "I can't come." She said, "No, you have to see this. Come down right now." So I go downstairs, and at our reception, there are two little kids, one probably 8 or 9 years old, and another a tiny kid. They're standing and they have this little check in their hands. They had brought their Christmas present. That was their Christmas gift, the check. And they handed it over saying, "We saw those little kids that had been affected by the tsunami. We want them to have this money." So that was the kind of connection that the tsunami built amongst people. It built bridges amongst people. So out of that huge horror also came goodness. It just brought people together. But it also meant we had to up our game. We had resources coming in. There was a lot of expectation of us as an organization, and there was a huge amount of need. We needed to respond immediately, and we needed to think about recovery. People had no homes. People had no livelihoods. We needed to think about recovery immediately. For the first time, at least in CRS's history, within the first week of the emergency, our teams had started working on strategic plans. In addition to response and recovery that was happening, they started working on a 3 to 5 year strategic plan, looking at the development needs, what would need to happen in those 3 to 5 years. So that was pretty impressive, and that has continued to happen in future emergencies. So very important point. As you are doing response, it's very important to remember what was the context, because as you do your distribution and your response, you could either improve, that's what you want, you can either improve situations, but if you're not careful, you could end up doing harm. So an important thing that CRS team members keep in their minds, with every decision, we have to weigh whether what we are thinking about doing, what the communities are thinking about doing, whether there is going to be more harm than good now and in the future through those interventions. Sometimes there might be good now, but it might influence future wellness of those communities. The other thing that was very critical, and I mentioned it a little bit earlier, was the different kind of technical expertise that we required. And one area that became very vital with this particular emergency was trauma counseling. And most organizations don't have, organizations such as ours, do not have a number of trauma counselors or psychosocial supporters within our organizations. So we started engaging with different universities and groups within the United States to see what psychiatrists and psychologists were available, interested in going overseas, but also who had experience working in these countries before, because you wanted these people to know what the communities were going through and have a background of the communities. So we were also able to share some of the rich resources in terms of psychosocial support that the United States had with our teams and our partners overseas. In our emergency response and our recovery, all our teams took into account where the communities were before. For an example, Sri Lanka. Before the emergency happened, you had a huge division within communities, especially within LTTE, the Tamilian Tigers, and the Buddhist communities and the Christian communities. So we had to ensure the way we were doing our response and recovery would build bridges amongst these communities. and establish a brighter future. Working with emergencies, one of the realizations that you have early on is coordination and collaboration. You cannot lose sight of it. We have found in CRS that while we have very strong partners, as well as staff on the ground and have a keen knowledge of community members, there are certain things as an organization that we have a lot of expertise doing. But there are also areas where other organizations complement our efforts. There are other areas that there are several other organizations that bring a lot of expertise. So it makes absolute sense for the good of the community, to serve the community, to start working together, to collaborate with each other. Very important is also knowing what each other is doing. So if you are working in this particular community, with this community, on, let's say, issues of shelter, housing, drinking water, etc., you would want to know what your counterpart organizations are doing either in the area or in neighboring areas. Again, this is absolutely necessary for the good of the community and to build upon each other's initiative instead of being in conflict at your level with each other's initiative. This particular program, the GSN program, gives us this opportunity to bring you in and share some of our experiences working with these communities that have been affected by emergencies and continue to be affected by emergencies. As we look at the information, the various disasters that are out there, it can be a little overwhelming when you're looking at pictures of disaster after disaster. But I wanted to connect you to those people on the ground. Their lives are touched by how you think, how you behave, what you do. So what we would really request of you is continue to be engaged in issues of emergency and other development issues. Continue to raise your voice for those poor and the vulnerable that don't have a lot of voice. Continue to advocate on their behalf. Continue to contribute in thought, in emotions for them. Thank you very much.